For decades, we've been told that more medical testing equals better health care, especially as we age. The healthcare industry has convinced us that reaching 75 means submitting to an endless parade of screenings, scans, and laboratory work. But what if I told you that some of these tests are not only unnecessary, but actually causing more harm than good? What if the very procedures designed to protect your health are instead creating anxiety, leading to dangerous treatments, and diminishing your quality of life? I'm here today to challenge everything you thought you knew about medical testing after 75. As someone who has spent years studying geriatric medicine and witnessing the consequences of overtesting in our senior population, I want to share with you 5 specific medical tests that may be doing more damage than benefit to your well-being. This isn't about avoiding necessary medical care. It's about understanding when aggressive testing crosses the line from helpful to harmful. The medical establishment operates under the assumption that early detection always leads to better outcomes. This philosophy works well for younger patients, but after 75, the equation changes dramatically. Your body's ability to tolerate aggressive treatments decreases, while the likelihood of dying from other causes increases. Many conditions that would be aggressively treated in a 50-year-old may be best left alone in someone over 75. The first test that often causes more harm than good after 75 is routine mammography screening. While breast cancer screening has been hailed as one of modern medicine's great successes, the benefits begin to diminish significantly after age 75. The American Cancer Society acknowledges this, yet many doctors continue to order annual mammograms for women well into their 80s and 90s. Here's what happens when we continue mammography screening past 75. The test becomes increasingly likely to detect slow-growing cancers that will never cause symptoms or threaten life. These are called overdiagnoses, and they lead to overtreatment. A 78-year-old woman who discovers a small, slow-growing tumor through mammography may undergo surgery, chemotherapy, or radiation therapy for a cancer that would never have caused her any problems. The stress of the diagnosis alone can be devastating, not to mention the physical toll of unnecessary treatments. The accuracy of mammography also decreases with age. Breast tissue becomes denser in some older women, making it harder to distinguish between normal tissue and potential problems. This leads to more false positives, which means more anxiety, more follow-up procedures, and more invasive tests like biopsies that ultimately reveal nothing dangerous. Studies show that women over 75 are more likely to experience false positive results, creating a cascade of unnecessary medical interventions. Consider the psychological impact as well. An 80-year-old woman who receives a false positive mammography result may spend weeks in anguish waiting for additional test results. The stress can affect sleep, appetite, and overall mental health. Even when the follow-up tests reveal no cancer, the emotional damage has been done. Some women become so anxious about future screenings that they develop a condition called medical PTSD, where the fear of testing becomes more harmful than any potential disease. The second problematic test is routine PSA screening for prostate cancer in men over 75. The prostate-specific antigen test has been controversial for years, and its limitations become even more pronounced in older men. The fundamental problem with PSA screening in seniors is that prostate cancer becomes incredibly common with age, but most of these cancers are slow-growing and will never cause symptoms or death. When we screen men over 75 for prostate cancer, we're almost guaranteed to find something. Studies show that up to 80% of men in their 80s have prostate cancer cells, but only a small fraction of these cancers will ever become clinically significant. This means we're detecting and treating cancers that pose no real threat while subjecting men to the serious side effects of prostate cancer treatments. Prostate cancer treatment in elderly men often results in permanent incontinence and erectile dysfunction. These complications can devastate quality of life for the remaining years. A 77-year-old man who undergoes prostate surgery may spend his final decade dealing with embarrassing accidents and the loss of intimate function, all for a cancer that might never have bothered him. The psychological impact extends to relationships as well, often causing strain between partners and leading to social isolation. The PSA test itself is notoriously unreliable. Levels can be elevated due to enlarged prostate, infections, recent physical activity, or even bicycle riding. This leads to unnecessary anxiety and follow-up procedures. Many men undergo multiple prostate biopsies based on PSA results, and these procedures carry risks including infection, bleeding, and pain. Some men develop chronic prostatitis following biopsy procedures, creating ongoing discomfort that wouldn't have existed without the screening. The third test that often causes more harm than good is routine colonoscopy screening after 75. While colorectal cancer screening has proven benefits in younger populations, the risk-benefit equation shifts dramatically in older adults. The preparation for colonoscopy alone can be dangerous for seniors, particularly those with heart conditions, kidney problems, or difficulty maintaining proper hydration. Colonoscopy preparation requires drinking large volumes of bowel-cleansing solutions that can cause severe dehydration and electrolyte imbalances in older adults. These imbalances can trigger heart rhythm abnormalities, kidney dysfunction, and dangerous blood pressure changes. Emergency room visits following colonoscopy preparation are not uncommon in the elderly population, with some requiring hospitalization to correct fluid and electrolyte problems. The procedure itself carries increased risks for older adults. The sedation used during colonoscopy can cause breathing problems and blood pressure instability in seniors. The mechanical manipulation of the colon during the procedure can cause perforation, especially in older individuals whose tissue may be more fragile. Recovery from colonoscopy complications often takes much longer in elderly patients and may require extended hospitalization. Perhaps most importantly, finding and removing polyps during colonoscopy in people over 75 rarely changes long-term outcomes. Most colorectal cancers take years to develop from polyps, and the likelihood that a 78-year-old will live long enough for a newly discovered polyp to become problematic is relatively low. Meanwhile, the stress and physical demands of the screening process are immediate and certain. The fourth problematic test is routine bone density scanning after 75. While osteoporosis is indeed common in older adults, particularly women, routine DEXA scanning often leads to overdiagnosis and overtreatment of this condition. The standard criteria for diagnosing osteoporosis were developed based on younger populations and may not apply appropriately to people over 75. Here's the fundamental issue with bone density testing in the elderly. The medications used to treat osteoporosis come with significant risks that may outweigh the benefits in very senior adults. Bisphosphonates, the most commonly prescribed osteoporosis medications, can cause unusual fractures of the thigh bone after long-term use. These atypical fractures can be devastating and may actually be more dangerous than the hip fractures the medications are meant to prevent. Bisphosphonates also increase the risk of osteonecrosis of the jaw, a serious condition where the jawbone begins to die. This complication is more common in older adults and can lead to chronic pain, difficulty eating, and significant impact on quality of life. Some patients develop severe esophageal irritation from these medications, making swallowing painful and potentially leading to malnutrition. The psychological impact of an osteoporosis diagnosis can be profound in older adults. Many become fearful of normal activities, leading to decreased mobility and social isolation. This fear-induced inactivity often causes more harm than the osteoporosis itself, as regular movement and activity are crucial for maintaining bone health, muscle strength, and overall well-being in seniors. The fifth and perhaps most concerning test is routine cardiac stress testing in asymptomatic adults over 75. These tests are often ordered as part of preoperative evaluations or routine cardiac assessments, but they frequently create more problems than they solve. Stress tests in elderly individuals often reveal abnormalities that would be considered normal aging changes rather than dangerous pathology. The exercise stress test itself can be dangerous for older adults, particularly those with underlying heart conditions that haven't yet caused symptoms. The physical demands of the test can trigger heart rhythm abnormalities or even heart attacks in vulnerable individuals. Nuclear stress tests expose patients to radiation, and the cumulative radiation exposure from multiple tests over the years can become significant. When stress tests reveal abnormalities in elderly patients, the next step is often cardiac catheterization, an invasive procedure that carries substantial risks in older adults. The contrast dye used during catheterization can cause kidney damage, particularly in seniors who may already have compromised kidney function. Blood vessel complications are more common in elderly patients, and recovery takes longer. Perhaps most problematically, finding blockages in elderly patients often leads to interventions like stents or bypass surgery that may not improve outcomes in this population. Studies have shown that many elderly patients with coronary artery disease do just as well with medication management alone, avoiding the risks and trauma of invasive procedures. The stress of cardiac procedures can trigger cognitive decline in some older adults, a condition known as post-operative delirium that may have lasting effects on mental function. Throughout all of these examples, we see a common theme. Tests that were designed to help often end up causing cascade effects of additional testing, anxiety, and treatment that may be unnecessary or even harmful in the elderly population. The medical system excels at detecting abnormalities, but struggles with determining when those abnormalities actually matter for older adults. Consider the story of Margaret, an 82-year-old woman who felt perfectly fine until her annual mammogram revealed a suspicious area. The biopsy was benign, but the experience left her anxious about every ache and pain. She began avoiding social activities and became preoccupied with health concerns. The screening that was meant to give her peace of mind instead stole her joy in her remaining years. Similarly, Robert, a 79-year-old man, underwent PSA screening that revealed elevated levels. After multiple biopsies and eventual treatment for slow-growing prostate cancer, he struggled with incontinence that made him reluctant to leave his home. His wife reports that the treatment changed their relationship and his personality, creating isolation and depression that hadn't existed before the screening. These stories illustrate a crucial point. The harm from over-testing isn't just physical, it's emotional and social as well. The anxiety created by abnormal test results, the time spent in medical facilities, the financial burden of follow-up testing, and the disruption to normal life activities all contribute to decreased quality of life in our senior years. This doesn't mean that all medical testing should stop at 75. Rather, it means that testing decisions should be individualized based on overall health, life expectancy, and personal values. A healthy 75-year-old who expects to live another 15 years might benefit from certain screenings that would be inappropriate for an 85-year-old with multiple chronic conditions. The key is having honest conversations with healthcare providers about the goals of testing. Are we testing to extend life, improve quality of life, or simply because it's routine? Understanding the potential consequences of both positive and negative test results is crucial for making informed decisions. Sometimes the best medical care is knowing when not to test. For those over 75, focus should shift toward maintaining function, managing symptoms, and preserving quality of life rather than aggressive screening for potential problems. Regular exercise appropriate for your abilities, social engagement, proper nutrition, and management of existing conditions often provide more benefit than extensive testing for new problems. The medical system profits from testing, and many doctors have been trained to believe that more testing is always better. However, the evidence increasingly shows that this one-size-fits-all approach doesn't serve our oldest adults well. We need age-appropriate care that recognizes the different priorities and physiological realities of being over 75. Your health decisions should align with your values and life goals. If your priority is maintaining independence and enjoying time with family, then tests that might lead to treatments that compromise these goals may not be appropriate. If you're someone who wants to know everything possible about your health, regardless of whether it can be treated effectively, then you might make different choices about testing. The most important thing is that these decisions should be made thoughtfully, with full understanding of the potential benefits and harms. Too often, tests are ordered routinely without adequate discussion of what the results might mean for your particular situation. Don't be afraid to ask questions. What will we do differently if this test is positive? How will this information change my care? What are the risks of the test itself? Remember that reaching 75 doesn't mean you're broken and need constant monitoring. It means you've achieved something remarkable, and the focus should be on making the most of the years ahead rather than searching for problems that may never cause you trouble. Sometimes the most caring thing medical providers can do is recommend against testing, recognizing that less can indeed be more when it comes to healthcare in our later years. The path forward requires a fundamental shift in how we think about medical care for older adults. Instead of asking whether we can do a test, we should ask whether we should do a test. The answer to that question depends on your individual circumstances, values, and goals for your remaining years. Make sure your healthcare providers understand what matters most to you, so together you can make decisions that truly serve your best interests rather than simply following routine protocols that may no longer apply to your stage of life. 7 blood tests your doctor orders, but you don't need after 65. Dr. Evelyn Hart explains.